for snack now. Time for snack now. Munch, munch, munch. Crunch, crunch, crunch. We will eat a little, just a little, little. Munch, munch, munch. Crunch, crunch, crunch.
Nutrition starts at a young age, so United Way wanted to be able to focus on young children and be able to start healthy habits early on so that they can continue with those as adults. The United Way's mission is to help build a stronger community, and that is through health, income, and education. And so through our programs with the CPPW grant, we've been able to focus on promoting education in terms of nutrition and physical activity. Here at the Tucson Nursery School, we've been able to do one of our programs, which is the Family Style Meals. This is a program where the children have the opportunity to serve themselves, and that is important because it helps with portion control, and they're often more likely to try the foods that they do serve themselves. We worked with a lot of home care providers and did a program called Feeding with Love, and that was to also implement environmental change through wellness policies. Home care providers are a population that are often overlooked, so that is one that we wanted to target, being that they do work with children, especially young children, and so we offered the program where they had an opportunity to incorporate more nutrition and physical activity standards in the homes for the children that they serve. In the Feeding with Love program, I learned about changing the milk from 2% to 1%, about consuming more liquids, limiting the amounts of fats and sugars, and also increasing the amounts of fruits and vegetables. So at first it was difficult. It was a difficult transition because the children were used to the foods that are common, such as hot dogs and pizzas. But we were able to develop a discipline ourselves and the children, and with the parents, I had them sign off on certain things, such as I would not have quick in the milk, and that the children would learn how to chew more their foods rather than to just drink it. The children were eating more fruits and vegetables, but then they started to not miss the hamburgers as much, and they started to eat more of the food that was on their plate. They started to learn to eat spinach and asparagus, and they started just to make different eating choices. So I use less fats, less sugars, less salt, and I use more fruits and vegetables. I use more chicken, more fish, and more whole grains. It's helped me a lot personally. I started to develop a different eating discipline, and it's helped me lose weight, and I lost 14 pounds. One of the things that we did that was really special is that we worked with a lot of the preschool teachers, and we did that through nutrition institutes. And we did that, first we did that in partnership with the University of Arizona with the Summer Nutrition Institute, and we had great success. And so we continued that on in the fall and in the winter, where we invited preschool teachers to come and learn about nutrition standards and how they can implement that in their classrooms. And then we provided tools and resources so that they can actually carry that out. So to continue our work after CPPW, we did start a community of practice with home care providers, and we plan on continuing that, and that is an opportunity for providers to continue learning about the ongoing nutrition and physical activity standards. And we are also continuing with our work with another grant, which is to introduce children to fruits and vegetables on a regular basis.